Around the same time that John D. Rockefeller seized U.S. media, he also hijacked U.S. medicine. When it was discovered that drugs could be produced from petroleum, America's top oil mogul ordered his army of propagandists to invert reality accordingly. Medicines used for thousands of years were suddenly classified as alternative, while the new, petroleum-based, highly addictive, and patentable drugs were declared the gold standard. After buying the German pharmaceutical company that manufactured chemicals of war for Adolf Hitler, Rockefeller leveraged his political influence by pressing Congress to declare natural healing modalities unscientific quackery. Rockefeller then took control of the American Medical Association and began offering massive grants to top medical schools under the mandate that only his approved curriculum be taught. Any mention of the healing powers of herbs, plants, and diet was erased from most medical textbooks. Doctors and professors who objected to Rockefeller's plan were crucified by the media, removed from the AMA, and stripped of their license to teach and practice medicine. Those who dared to speak out were arrested and jailed. When evidence began to emerge that petroleum-based medicines were causing cancer, Mr. Rockefeller founded the American Cancer Society, through which he suppressed that information. John D. Rockefeller is duly credited as the founder of the pharmaceutical industry, and the reason that medical error is currently the third leading cause of death in America. This is not an indictment against doctors. More than anyone, they are under the stranglehold of the single largest lobbying power in Washington. Every year, the pharmaceutical industry spends at least twice the amount as big oil to influence laws, policies, and public perception. Thanks to Mr. Rockefeller, the architect of American monopolies, no industry has more power over our lives than Big Pharma.
1920s, an American scientist named Dr. Royal Raymond Rife developed a Rife frequency generator machine. The Rife machine produced low energy waves. These waves are also called radio frequency electromagnetic fields. They have low energy compared to X-rays or radiotherapy, which have high power. Today, using low energy waves as a treatment is less common, but there is some research on it. Dr. Rife experimented by introducing the BX virus into rats, which caused the rats to develop tumors. He was able to eliminate the tumors by exposing them to their MOR via his ray beam device. In 1934, a USC team of physicians led by Dr. Johnson transferred 16 terminally ill patients from a San Diego hospital to the Scripps estate in La Jolla, California. Here, they were subjected to the frequencies recommended by Dr. Rife for 90 days. Within 70 days, the USC team declared 14 patients clinically cured. The other two took 20 days longer.
Thing that comes from nature cannot be patented. They're not interested in that. So, we translate that into the real world of FDA approval. Surely these drug companies aren't going to spend $20 million or more testing any substance from nature because it can't be patented. That, and of course the FDA says it's illegal to use unless it's been tested for efficacy and safety. Now you see the catch-22 you're in there. Nothing from nature, regardless of how effective it might be, will ever be proven safe or effective according to the FDA. It'll never be. Because nobody's going to spend the money to go through the test. So therefore, everything from nature will always be condemned by the FDA as unproven.